Well, welcome. Good afternoon, and thank you for joining us for today's topic, which is the Freedom to Plan Act. This is designed to be an interactive town hall led by my amazing colleague, State Senator Mary Cavanagh. This is something that has been on the minds and hearts of so many of us throughout the state of Michigan and across the country. And I'm pleased to report some very good news and a little somber news. The good news is that the people of Michigan have spoken again and again and again. They have spoken with their votes, making sure that this issue, reproductive health care and the freedom to choose, is at the heart of our public policy. They also have elected men and women who have been on the right side of this issue. And we also have some sobering news, which is that this fight continues. So today's town hall will talk about the legislation that we continue to move forward in the state capitol. And we'll hear from some amazing panelists to talk about the issues that are impacting Michigan residents at this very moment. We ask you to join the conversation. This is, again, designed to be interactive. So please feel free to submit questions by going to the chat, whether you are joining us on social media or the other ways that folks are tuning in. We ask you to join our conversation. This only works, our democracy only works when it is an inclusive process. So we're excited for a powerful and impactful hour. All right. So for those of you who don't know me, my name is Sarah Anthony. I proudly serve the people of District 21, which includes most of Ingham County and all of Eaton County in the great state of Michigan. I also serve as the appropriations chairwoman. So it's where the money resides. So I will pause for a moment and allow our amazing panelists to introduce themselves. And I will, of course, start out with my colleague, Senator Cavanagh.
Thank you, Senator Anthony, for being here and moderating this very important discussion today. And good afternoon, everyone, not only experts for joining me. This is the second town hall that we're discussing not only this legislation, but this issue in Michigan and across the country that we're very excited to push forward and potentially change. So my name is Mary Cavanagh. I am the state senator for Michigan Senate District 6, which includes Northwest Detroit, Redford Township, Livonia, Farmington, and Farmington Hills. I'm also the youngest serving female to have ever been elected and serving in the Michigan State Senate. So this impactful legislation not only impacts all of Michigan, but also my future family planning. So that's why it was very important to me to partner with my colleagues and push forward this legislation. So let me get into it. The Freedom to Plan Act, that Senate Bill 973 and 974, break down the financial barriers to oral over-the-counter hormonal contraceptives and emergency contraceptives such as health plan, Plan B, as well as birth control pills. And so this legislation is requiring private insurers, mine specifically, that offers a health plan in the state, and Medicaid. That's a second bill. So that's going to be Senator Irwin's bill 974 to provide coverage for these types of contraceptives. So let me give you a little bit of statistics. So every year, 50% of pregnancies in the United States are unplanned. This is often due to a lack of access to contraceptive care. This is especially prevalent in economic and disadvantaged communities and less educated groups, such as teenagers. Unplanned pregnancies can be a life-altering, forcing birthing people to make difficult emotional, physical, and financial choices. And so being able to put contraceptives in the hands of everyone, not only those that can afford it, put the choice in their hands, and their options shouldn't just be available to those who can afford it. So we're really removing barriers to healthcare. This healthcare not only provides pregnancy planning, but also it's used for acne or PCOS or migraines. It even has a percentage to avoid ovarian cancer by taking some of these prescriptions. And it really, really shouldn't only be available to those who can afford it. So removing these economic barriers to accessing birth control can be life-saving and allowing for family planning to be the choice of the person and their healthcare professional. So I just wanted to say thank you for this incredible conversation. about this legislation. And again, thank you, Senator Anthony, for being here, as well as the experts. So I'll hand it back over to you.
Thank you, Senator. Thank you, Senator. Next, no stranger to those of us who have been fighting the good fight for a while in the state capitol, we'll turn it over to Ashley Fennessy with the Planned Parenthood Advocates of Michigan.
Hi, everyone. So yes, I'm Ashley Fennessy. I serve as the Chief Advocacy Officer at Planned Parenthood Advocates of Michigan, where we work to expand access to sexual and reproductive health care and education for our patients and our communities. The last few years, we have seen so many devastating attacks on access to this critical health care. More than 20 states across the nation have banned or severely restricted abortion. And we're even seeing attacks on other aspects of reproductive health care, such as IVF and potentially even birth control. And as we approach the election and voters across America are choosing between two potential futures, we do have a lot of concerns about the potential for continued degradation of our access to sexual and reproductive health care, especially at the federal level. But here in Michigan, we are so proud of what we have accomplished. One of the first states in the nation to enshrine the right to reproductive freedom in our state constitution. Then elected a pro-sexual and reproductive health majority for the first time in 40 years. And they immediately got to work passing the Reproductive Health Act, including some of the sponsors here with us today. But now we know that abortion access isn't the only part of reproductive freedom, right? Reproductive freedom means the ability to plan your reproductive future for yourself. That means the decision to have a family or not have a family, or to plan out when that happens and under what circumstances and with whom and at what point in your life. And that is why I'm so excited to support these bills that will help people to access birth control, which is one of the most basic forms of healthcare, and to be able to make those decisions for themselves and to build the families and futures that they want when they are ready. We know that recently Opill, the first over-the-counter contraception, hit the market, which could be a game changer for people's access to birth control. No longer would they need to, have an OBGYN, go to the physician, have all of those, overcome so many barriers to accessing care. They could go to their local pharmacy. However, we know that the cost is a barrier for a lot of people. So we need to make sure that insurance is covering this just like any other kind of birth control, so that everyone, no matter their access to transportation, the amount of money they make, whatever their circumstances may be, that they can have more control about their reproductive futures. So thank you both for your work on this, and we are so excited.
Couldn't find the mute button. Thank you. Thank you. Listen, this is already getting good. I'm already excited about this town hall. All right. So a week or so ago, we introduced a resolution for World Contraception Day. And in my remarks supporting that effort, I think I mentioned, and many of us have mentioned when we talk about reproductive health care, is that these decisions should not be made in Capitol buildings and in county commission halls, and these should be made in your doctor's office with a healthcare professional. And knowing that this is such a private conversation between men and women and their physicians, we thought it was important to actually add medical experts to this conversation. So we have two powerful voices in the healthcare space that have joined us today. And instead of me introducing it, maybe Dr. Klein, you could start by introducing yourself and just sharing a few words, and then we'll turn it over to Dr. Said.
Hi, everyone. My name is Dr. Klein. I am a academic specialist, obstetrician gynecologist. I work at Corewell Health in Dearborn, Michigan, and I am our family planning faculty director. So in my experience, I've been working with our resident physicians, our medical students, and other faculty to expand reproductive access for patients in our hospital and our area. And this is a topic that I'm very passionate about. And through Michigan's support and laws, we've really been very successful in getting patients the choices that they want so that they can make those decisions of if to start a family, when to start a family, how to start a family. So I think it's really important that we give patients the freedom, the power to make these decisions for themselves. So I look forward to talking a little bit more about some of my experiences. I'll let Dr. Saeed present herself and some.
Hey, good afternoon, everyone. I'm Dr. Suha Sayed. I'm a fourth-year OBGYN resident that works out of Royal Oak, Michigan. Here with Dr. Klein, representing the American College of Obstetrics and Gynecology, also known as ACOG, which is an important governing body for OBGYNs across the state and the country. We as OBGYN physicians have been aware of the importance and the impact of over-the-counter hormonal contraception and emergency contraception for many years now. It's frustrating when our medical advancements and research studies continue to improve, but our patients' ability to access these data-driven treatments don't keep up. Michigan Senate Bills 973 and 974 address this very frustration by focusing on expanding access by requiring insurance plans to cover all of the FDA-approved contraception and emergency contraception methods. ACOG does support this legislation with plenty of data highlighting the efficacy and safety of providing this service. These bills would reduce financial and logistical barriers to essential reproductive health care. And with all of the recent challenges to women's reproductive and contraceptive rights throughout the United States, this legislation would continue to exemplify Michigan's commitment to safeguarding access to comprehensive reproductive health services and improving the lives of women and families across the state. I'd like to share a couple of examples of patients whose lives would have been fundamentally different had this legislation existed in the past. The first is a tragic example of a patient who we saw recently in the ER who had been sexually assaulted, but hadn't presented for care until a week later when, unfortunately, it happened to her again. Emergency contraception methods are only effective for a short time period after unprotected or unwanted sexual intercourse, and she was unfortunately already outside of this window. When we asked her why she waited so long to seek care, she talked about feelings like shame and fear of judgment by her healthcare providers. She did actually end up pregnant, and having to make decisions regarding that pregnancy was very emotionally taxing on her. Had effective emergency contraception been covered by insurance over the counter, this patient could have accessed this care for herself much sooner without the added barrier of sharing her trauma with a healthcare provider. And while this story was a devastating example, we see patients every single day who would benefit from this type of legislation. Just recently, I saw a young woman who had been on oral birth control pills for several years, not only for effective contraception, but also to manage her abnormal menstrual cycles. When she changed her job, her insurance changed. She had to find a new OBGYN provider to refill her script. And as we know, it's really hard to get a timely appointment with a healthcare provider nowadays. So she did end up without contraception for a month. She did end up with an unwanted pregnancy. With birth control available over the counter and covered by insurance, this patient could have gotten her medications without waiting on a provider and not have to worry about the financial burden that would have caused her. And this same benefit would translate to thousands of other women and birthing patients across Michigan who rely on contraception to combat a myriad of different concerns and symptoms.
Thank you, both doctors. Thank you. This is such a powerful topic. I was looking over my notes and reflecting on how much has changed for the people of Michigan and really our country just in the past few years. It's hard to imagine that it was June of 2022 when the Supreme Court overturned 50 years of precedents by literally telling us that you had no constitutional right to an abortion, right? Just thinking about that still gives me shivers because I remember how we all ignited immediately. Many of us took to the Capitol steps, into the streets across the country, and Michigan ignited as well. Now, Ashley already talked a little bit about some of the work that we've already been able to accomplish because of the changing of the guard in the House and the Senate and having a governor who has had the conviction and courage to sign the bold legislation we have championed into law. And I don't want this to go unrepeated, I guess. We repealed the 1931 abortion ban. Did that, check. The Reproductive Health Act literally just codified all of the protections that were reflected in the ballot proposal, Proposal 3, affirming these essential rights. But we also have been doing some pretty transformational work in the Capitol just related to healthcare, reproductive, maternal health in general, thinking about Black maternal health. We've been doing things around centering pregnancy, working alongside private insurers to make sure that, again, people are getting the care they're needing. Coverage for prescription contraception, like we have many receipts of the work that we've already accomplished or continue to fight towards. And literally, this is just in the first basically 2 years. But there's more work to be done. And the package that Senator Cavanagh is spearheading right now is an example of that continued work. So I wanted to pause and bring all of us into the conversation to start having, a more formal discussion around the work that's happening and the work that's still yet to be done. So I will turn my first question over to Senator Cavanagh. Can you talk a little bit about the specific products that would be covered under this legislation?
I'd love to. And you got me all excited, all about the legislation that we're talking about, but all of the things that we get to do and have done. Just to add that it is almost like a breath of relief to live in Michigan after the amount of stuff that we're able to accomplish with what is happening federally. I don't want geography to decide what health care and what health reproductive system that I get to manage based on where I live. So I'm just very excited about all of the checks that you went through. So back to your question. So what products would be covered under this legislation? We kind of touched on it a little bit earlier, as well as some of the doctors. This legislation will cover oral, hormonal contraceptives, and emergency contraceptives. So that includes the first FDA-approved OTC, so that's over-the-counter birth control pill, O-pill, and emergency contraceptives such as, I think the most famous would be Plan B. We believe advancing in medicine, such as the availability of the OTC birth control pill, requires advancement in law. And so that's exactly why we're pushing this forward. Thanks for the question.
Awesome. That's awesome. Thanks, Senator. Now I'm going to turn it over to anyone on the panel. This is a very practical question, but sometimes I think the practical is the most helpful. Let's say it's me. Do I need to report my purchase of the medication covered in these bills to my insurance for a reimbursement?
I believe the answer to that is no, because with this bill, the insurance would cover the prescription according to your insurance plan at the point of sale. And that's what's so important and unique about this bill, is it increases access, increases ability to obtain these emergency contraceptive, birth control items at the point of sale.
Thank you. Thank you. That's super helpful. Thank you. All right. Got another practical question. We're on a roll here. All right. So I recently switched to using a more effective contraceptive. If an even more effective medication comes along, would my insurance cover it under this legislation? So we've all been there. Patches, pills, shots, et cetera, et cetera. One of the doctors probably knows what's the average amount of different birth control or contraceptives that women try. Many of us have tried a lot of them. So what happens if you switch over to something that's a better fit for you?
As long as that medication is FDA approved, the bill would continue to cover those medications. So even if something passes after this bill is passed, it would be covered under the insurance as well.
Hallelujah. Good. This is awesome. All right, this one is specifically for Senator Cavanagh, although Ashley, I think you could probably chime in here as well, given your legislative experience. So many of us live and breathe policy and getting bills signed and getting to the governor's desk. Other people have other lives. So talk to us about the next steps in getting this bill enacted into law? If this legislation is signed by the governor, when would it go into effect? So a little bit about the process and where we are in terms of timing, and then what's next.
Yeah, I love those questions because it can get a little bit nitty gritty when it comes to Lansing and what is reflected back to what people understand of, okay, great for the committee. When are we going to hear it? And when can we actually feel it happening in our insurance or even in the Medicare? So to answer your question, what is exciting is we actually heard these bills in health policy already. So that's the first step, is to hear the bills in committee. Second step would be to vote the bills out. Once they're voted out, we can vote them out on the floor. And it's looking really good with the majority that we don't need any Republicans to put it over to the House, so we can get a majority there. But regardless, if we can get majority vote or even any Republicans, this bill specifically says it will go into effect January 1st of 2026. So we're going to go through the committee process, both the floors of the Senate and the House. But looking for first effect January 1st, 2026, so we can also prepare, everyone can be prepared for the rollout.
Awesome.
Yeah.
Got anything to add, Ashley?
I think that was a great description, and I appreciate how thoughtful you're being about the rollout and to make sure this is really thought through and a model for other states in the future too.
Yeah, and actually, if I can add a caveat, what helps with the committee and the floor votes, reach out to your local elected officials. Reach out to your state house representatives, your state senators, regardless of party. This is for the entire state, and this is for all of our rights. So just let them know that this is an important piece of legislation that you want to see get across the finish line. And I think that's first and foremost.
Yes, definitely. And I know with the current majority we have in power, you're all supportive, but I know you have a very, very long list of things to get done before end of session. So I think folks reaching out, especially with personal stories, can be helpful and making sure it's at the top of the agenda.
That's right. That's right. Love it. All right, we'll turn it back over to the doctors. It's like that show, The Doctors. It's just, I don't know. Anyway, I'm going to turn it back over to you all. Talk to us about the kinds of people you believe will be most directly impacted by this legislation.
I can talk about this a little bit.
Yeah.
So Michigan's a great state. We have some really great healthcare facilities, healthcare systems, but we have to be honest, we have healthcare deserts. And we have a very diverse population in our state, geographically, ethnically, religiously, socially, socioeconomically. So this will really help reach out to those geographically diverse patients, people who are living in other areas. For instance, I've had a few patients, I personally don't really know why, but they've traveled from Upper Michigan, Traverse City, Charlevoix to come see me because they either couldn't get into an OBGYN up there in an appropriate amount of time, or they did and they weren't really comfortable with that person, and there's not that many choices. So I think this bill is so important because it provides those people access to medications to be affordable or to have that insurance coverage without having to get a prescription from a physician or nurse practitioner or a physician assistant. The other thing that I think this is helpful for are we have a lot of economically disadvantaged patients in our area. Making it to doctor's appointments can be challenging. They may have other children, other responsibilities, and having that additional boost to be able to get the medication at an affordable price or fully covered by insurance will help patients have this access to make the choices that are best fit for them. So those are a couple of examples of patients who I think might benefit from this bill, or who would definitely benefit from this bill, but I'm sure a lot of other patients would as well. And I'll let Dr. Said talk a little bit if she would like to as well.
Nah, I think you got it. Sounds great.
And you know, I think that it is important to note the intentionality behind this legislation. So much of what we have tried to do as Senate Democrats is centering people and using an equity lens as we are moving legislation forward. And so the fact that we're lifting people up from different geographic areas, racial, income levels, that doesn't happen by like happenstance. There's intention there. And I just know Senator Cavanagh just it lives and breathes it, right? Like in just what she does, as well as Senator Irwin. So thank you for just disaggregating that in a way that's, I think really important.
And another interesting thing about this bill is there's currently no federal requirements that requires insurance plans to cover non-prescription contraception. So this really allows us to be a leader for the entire country. Other states could follow in our example, hopefully, and help patients throughout the entire country. So I think this is a great opportunity for Michigan to really lead the way.
Yeah, right on.
And if I can just add, I think the doctor had a really good point of it not just being, a few stories here, a few stories there. I think everyone has their own personal story, either with contraceptives or over the counter or reproductive health story. And I think it's just so unique to the person. And so I think it needs to be able to be in their hands. And as we heard constantly through this town hall, it's, the doctor's offices are booked 3 months out. You don't have a gynecologist, or you don't have that copay where you're worried about how much is going to be when you leave that doctor's office. And when we talk about these preventative medications or even birth control, 1 month can, be that decision maker of having, a child or not, or even, your PCOS comes back or your migraines come back that make it impossible to go back to work. It can be life altering or it can be life saving. And I don't think it should be only in the hands of people that can afford it and don't have that insurance coverage. So I just wanted to add that in there with a little bit of the town hall speaks that we're talking about, just so it's not just these off stories. I think it's going to impact each and every one of us. If not us, then someone that we know in our family.
That's right. That's right. And I'm just pausing for a few moments to have some housekeeping pieces. One, I believe Senator Cavanagh may have to dip out just a little bit early. So I just want to make sure if you want just to give a few remarks before you have to transition out.
No, I appreciate that. I was going to hop in because I know we've been working very well on reproductive health in Michigan. Senator Anthony, I appreciate you being here. And I say that because if I hop off early for some questions, I know that you know a lot about what we're trying to do up there, and I appreciate you even moderating. I will be on for a little bit longer, but I heard earlier today that the vice presidents will be visiting Senate District 6, so I did want to give some remarks. So, but I did want to just say thank you. I'll be on. I appreciate it, and I think we're doing some really good work. But back to the questions. This is going in a really great direction. I appreciate it.
Awesome. I guess we can give bump for the Vice President of the United States. If you're gonna leave us, it gotta be for the Vice President. So awesome. And again, a reminder, this is interactive. So if you are logged in, if you are streaming live, please use the Q&A webinar chat function, or just like make comments on the stream, however you are viewing this town hall. It is a dialogue, it's a discussion. So join in on the conversation. All right, here's another question that we have. And this can go to literally anyone. So the folks who are tuning in right now are clearly interested, they care, they are passionate about reproductive health care. What can they be doing to help this and some of the other legislation that is moving through the legislative process? What can people do?
And I'll hop in first because I think I'm gonna have to go after this, but I think I just want to piggyback on where we left off. I think it's very, very important to share your personal story. If you're comfortable with it, call your legislators, tell your family and friends how important not only that this legislation exists, that it's in the state, that it's moving through committee, just because it is important to spread the word around your family, around your friends, because that also ignites that communication with local elected officials, state representatives. I know I talk to my township supervisors, I talk to my council members. So telling your local elected officials really goes up to caring how impactful this legislation is across the entire state. So I'd highlight, give your state senators and your state representatives a call or an email. I think that would be very helpful, especially as we move through the committee process. But I do want to open it up for everyone else. And again, thank all of the professionals and the experts on here tonight. Thank you for carrying on this discussion again today.
Thanks, Senator. What else can folks do? What else can folks do who want to see this and other legislation moving through the process?
Vote for people who care about your reproductive rights.
Mm-hmm.
I would also say talking to your friends and family members about why this is so important. You know, some folks feel like maybe they don't have a lot of power, but you are the most powerful person to talk to the people who are in your life. So yes, contact your legislator, but also contact your friends.
That's right. I remember a few years back when my niece, who just turned 18, was on the fence about whether to vote or not, and reproductive health care was the thing that really ignited her passion of public policy. It was something very practical that she could communicate to her friend group and ultimately at the ballot box. So I think that's it. That's it. All right. So going back again to some of the practical. This may be a question for one of the doctors, but I think anyone can chime in. So since you don't need a prescription for these contraceptives, what can you tell me about the safety of these medications for someone just picking them off the shelf?
I can talk a little bit about this. So there's two different categories of kind of medications that are being discussed in this bill. There's emergency contraception, and then there's like, over-the-counter hormonal contraceptives that are two kind of different classes of medications. When we're talking about emergency contraception medications, they're safe. There's no patient that we say is like not able to take that medication. There's no contraindication to taking that medication, and the benefits always outweigh the risks. So when it comes to emergency contraception, we feel very good about that. As far as oral contraceptive pills, they've also been shown to be very safe, even over the counter. Yes, there are some patients that may have certain contraindications to birth control pills that contain estrogen. However, all of our studies have shown that women are very capable of self-screening themselves with checklists that show exactly who is safe to take the medications, who isn't, and that continues to be a completely fine way of allowing these medications to be available for patients to receive over the counter without a prescription.
That's helpful.
And just in addition to that, patients who have questions can always speak with a pharmacist who's well versed in these medications and can talk with them at the pharmacy.
And Dr. Klein, I have been thinking about how many pharmacies have closed. Traditional drugstores that quite honestly just have, I don't know, like, and they're largely in many communities, as you mentioned earlier, but there's not many other options. And so for the few communities that do have these types of resources still available, having a trained pharmacist there to kind of workshop some of the technical pieces of the prescription is really important. So, or not the prescription, but you get what I'm trying to say. So, Ashley, did you want to chime in? Probably on the next question.
Yes.
Probably talk to the next one. All right, cool. All right, so there is a question about, are we voting on reproductive health care this election, November 5th? So, Ashley, you want to talk a little bit about what's on the ballot?
Yes, absolutely. Reproductive freedom is absolutely on the ballot this year. While it may not be as direct as Proposal 3 was, we are choosing between two very different futures as we head to the ballot box this year. At the federal level, I cannot overstate how devastating another Trump presidency could be to sexual and reproductive health care. Of course, we've seen the continued attacks on abortion access with even more anti-abortion judges, anti-sexual and reproductive health judges installed. We could see the erosion of our constitutional rights continue. We also know that in the last Trump administration, Planned Parenthood and other abortion providers were completely kicked out of Title X, the nation's largest family planning program that provides essential birth control, STI testing and treatment, breast cancer screenings. And when those providers were forced out of the programs, millions fewer people were able to access that care in their communities. We're also seeing, of course, potential attacks on IVF, potential attacks on the Affordable Care Act, which included a lot of protections for access to birth control and other types of health care. And then here at the state level, the Michigan House is up for election, and they have been so crucial to our ability to pass state level protections and to expand care here. And I'm sure Senator Anthony could also speak to the financial investments we've been able to make in reproductive health care, in maternal health, in addressing the Black maternal health mortality crisis. So yes, when you head to the ballot box, yes, you are voting for candidates, but you are also voting for your access to birth control, your access to sex ed, to abortion, and honestly, the future of our democracy as well.
Thank you. Thank you. And obviously, this is a town hall that is run by the state of Michigan. So we cannot advocate for any specific candidates or ballot initiatives or proposals, but we can absolutely encourage you to do your research and to make your voices heard. There's a lot of information, nonpartisan information that is online about where candidates stand on reproductive health care. So we encourage you to empower yourself with information. Speaking of information, as you can imagine, since probably the beginning of time, misinformation has been through the roof. When people call our office, we try to refer them to just the facts, government websites, places that they can get sound information about healthcare. So as someone who is paying attention, what kinds of misinformation have been spread about these particular bills? And how do we counteract that narrative? So what are you all hearing? What can we prepare our listeners for what they may hear that is just flat out wrong or flat out a lie? How do we empower people with good information?
I can start with one thing that I've heard. As far as emergency contraception goes, there's a lot of misinformation that emergency contraception pills are similar to abortion pills or induce abortions. I just want to say that that is completely false. The way that emergency contraception pills work is that they're working to prevent pregnancy. They would have no effect on an existing pregnancy or an existing fetus or anything like that. And so those two things being compared is absolutely not true.
Any other misinformation nuggets out there that folks should be aware of? All right, great. Okay, so another question, this could be for all of our panelists, what are some other contraceptive or reproductive health care issues that are not covered by these bills that you, as our resident experts, think that you would like to see solutions for? So what are we missing? What haven't we gotten to yet in the reproductive healthcare space?
I'd like to take this.
Yeah.
I am an abortion provider, and I provide that service for people in the state of Michigan and who come from outside the state of Michigan. And currently, we don't have insurance coverage for abortion because of the Hyde Amendment, except for cases of rape, incest, or threat to maternal life. This is devastating for a lot of pregnant patients who have fetal anomalies that are not compatible with life, where insurance just won't pay for it. In those cases, a lot of our area hospitals who are already under a lot of financial stress and don't get reimbursements from Medicaid often go out of our way to provide these services free for patients in need. And as a healthcare provider and someone who works in a healthcare system, I don't think that's fair to our hospitals to be doing that. Insurance companies should be paying for these services for patients. And I think we need a bill introduced to at least get insurance coverage for fetal anomalies, for termination pregnancy for fetal anomalies, but really insurance coverage for pregnancy termination for any reason.
Thank you. Anything else? What is any other big issues, policy pieces that we need to be prioritizing just to make more reproductive health care options or just protections for Michigan families?
Yeah, if you don't mind, I'd say it's something that we are also working on. I wanted to give a shout out to some of the bills that are in the House that are also related to contraception. So there are bills that would allow pharmacists to prescribe contraception, which would also greatly increase access to those methods that are not yet available over the counter. And there are bills to allow folks to get a 12-month supply of birth control at a time rather than just 1 month or 3 months, which removes a lot of the transportation and access barriers for people to access that care. So those bills went through committee in the House and are waiting for a floor vote, and then will hopefully be to you guys here in the Senate, and would really add to this overall effort around improving access to contraception. And then I would also advocate an even wider view of how we're looking at reproductive health care, and not just health care, but the ability for us to care for ourselves and our families. And I know that there is some proposed legislation for paid family and medical leave, and making sure that when people do decide to grow their families, they have that time to recover, to bond with their families. And then if they have a sick loved one or other person they need to care for, that they can have that time and not fear, losing their job or not being able to pay the bills.
Right. That's right. As you know, paid family leave is my jam. Pocketbook issues, it all connects. It all connects. So thank you for lifting those up. Listen, so again, I'm gonna do another plug for questions as I somewhat wrap up questions for this particular panel. So this is just another very practical question. Why is over-the-counter contraception needed? And we've talked a little bit about this in very broad terms, but if you all have any personal stories, either from patients or anyone else that you've come in contact with, because I think that there's still somewhat of some misinformation. Some people say that, look, can't women just get a prescription from their doctor in order to have their insurance cover it? I mean, this is just very basic. Like, why fundamentally is this needed? Talk to someone who's still maybe on the fence or just doesn't understand the need for this particular bill. Or these packages of bill, I guess you say.
But I think we could kind of look at it the same way as over-the-counter Tylenol, Advil, Pepcid. Like, why not require prescriptions for all of those to be available? It's access. It's people to be able to make the decisions that are right for them in regarding a FDA-approved safe medication, safe to use, and so that patients can make these decisions for themselves and have that access more readily available and options available.
I love that. Why not? Why not? I love that. All right, so we're going to start to wrap up a little bit, and I wanted to give each of our panelists an opportunity just to give a few closing remarks. And if you have any action items or practical next steps for folks who are joining us virtually, it would invite you to share those next steps as well. So anyone can start. But y'all been so gracious. It's been like no one's been like overpowering the conversation. It's great. So But again, just closing remarks and next steps for folks who are joining us today.
I can start. So these bill packages that we're looking at today, the whole point is, like we've said time and time again, is to increase access to contraception. There's no point having all of these amazing things that women and families can use to protect themselves and to take care of their health when patients don't have the means to access them, patients don't have the means to pay for them. Why do we have these medications if we can't even get them to the patients who really need them? And so these bills are really working hard to make sure that these medications that we have are actually making it into the hands of patients who need them, who desperately need them in order to successfully plan for their lives. And so passing this legislation would be an easy and safe and effective method to increasing access for women across the state, and would be a very good direction in the step of improving maternal health outcomes and just women's health outcomes in general.
Awesome. Thank you, Doctor.
Yeah, I would echo that. And I would also say that, there is no other decision that is more impactful on your life than the decision of when and how and with whom to build a family. There's nothing that will impact your personal life, your family life, your economic situation, than that decision. So the access to birth control, which should be so easy, it is one of the most basic forms of healthcare. We have to make sure that, as Dr. Syed said, that it's easily in the hands of people who need it, and that your ability to plan for your entire future shouldn't be the barrier to that shouldn't be, whether you can find an OBGYN. And I do, before I pass it off to the other doctor, want to point out that in Michigan, it is easier to find a veterinarian than it is to find an OBGYN. There are more counties with veterinarians than with OBGYNs. So if folks think that there is not an access problem, I just want to reiterate that for a lot of folks, there definitely is.
Thank you. That's also just, I can't even wrap my head around that, honestly. It's scary stuff. So, all right, take us home, Dr. Klein.
Just a couple of things. First of all, I want to say Senator Anthony and also to Senator Cavanagh, thank you so much for the work that you're doing. It's so important, and it affects me, it affects my patients, it affects our communities. So thank you so much for leading the way on this. Just to end, everything that everyone said, I fully agree with. It's an important access initiative for our patients, for our state. It allows us to lead the way in the nation. It helps our communities. If people are continuing this work, I recommend the Guttmacher Institute as a resource for statistics on pregnancy, contraception, and other similar topics of family planning in the United States and abroad. So if people need statistics or research, that's a great place to start in order to get information to present. So thank you so much again. I really appreciate you having us here today.
My goodness, thank you. Thank you all so much for joining us. This was a powerful panel of like real experts. We love to actually connect with people who know what they're talking about. So thank you so much for being on. Thank you again to Senator Cavanagh for leading in this effort in the halls of power. We wanted to let you know that you can follow the Senate Dems for the latest information about this package and watching it move throughout the legislative process. So feel free to visit senatedems.com for additional information on this package and other powerful legislation that is informed by the people. So we just thank you for taking the time with us today. Excellent job, everyone. And please take care of yourself and take care of your neighbors and your loved ones. And we look forward to more discussions like this in the future. So thanks again for joining us, everyone.
Thank you.